Hi, if you had COVID-19 and now you cannot do anything, you're so tired, you sleep all day long and you wake up more tired than you slept, then you might be having chronic fatigue after COVID-19. And this is not an uncommon situation people find themselves into. After COVID-19, we are seeing lots of people are developing chronic fatigue. They're so tired. They just have no energy throughout the day and they cannot just even any mental or physical processing. They walk a little bit or they just move anything. They feel exhausted. And this is like really changing their life and affecting them. I have patients who were marathon runners, very fit and athletic, and now walking to the store is so much work for them. So what is really happening here? So what happened is that there are multiple potential causes, but what happened is that when there is an inflammation with COVID-19, it can affect the brain and it can affect multiple systems. The first system that can be affected is the hormonal system, the pituitary gland, the thyroid. So sometimes there will be some hormonal imbalance that leads to fatigue and all of that. So you can see the doctor. There is hormonal testing. You test the pituitary function, you test the thyroid function, the other hormones, the cortisol. All of those can be tested. And if you have any imbalance in those hormones, fixing that will hopefully restore your fatigue and restore your function. I see in my COVID-19 recovery clinic lots of patients who have this fatigue problems, and we test them for sleep as well. And sleep apnea is a common complication after COVID-19. And sleep apnea is literally you've been woken up so many times, you snore, you wake up so tired, you just did not get refreshed, you wake up multiple times at night. And all of those can be due to sleep apnea. And the way to deal with that is to see the sleep doctor and sleep clinic, you get overnight sleep study, and that will show if you have sleep apnea. And if you do, fixing the sleep apnea is essential because that can restore your energy and your oxygen at night. And wearing the CPAP can really help. And the third potential cause is muscle fatigue and muscle issues. So in COVID-19, it can attack the muscles and affect the breathing muscles, the physical muscles in the body, and that can cause inflammation in the muscles, and that can lead to fatigue. So those marathon runners, they have like so much work to do and the muscles are so tired, and they can have some inflammation in the muscles leading to fatigue and pain, and they cannot even breathe good and well. And the other fourth thing can be because of the lungs themselves. There is a scarring in the lungs that led because of the inflammation after COVID, especially if it was severe COVID that needs intubation or being in the hospital. So seeing a lung doctor and looking at the lungs with CAT scans, with pulmonary function tests, that's very helpful to see if the activity will be reversed and if there's any treatment available to reverse that and help with fatigue. And the fifth thing we never forget is if you have COVID-19, it can very well lead to anxiety, depression, PTSD, because to be honest, COVID-19 can be a life-threatening condition. And sometimes it's the experience that you experience COVID-19, you think that you kind of die, or you heard on the news that some people died from COVID-19 and you only see the numbers and you think that you will die. So this is a major traumatic experience, and it can lead to PTSD and depression and anxiety, and this can be associated a lot with fatigue and inability to work and inability to do anything, and treating depression and anxiety can help with that. Other treatments possible if you fix all of the conditions that we talked about is stimulants. So can stimulants work or not? I mean, there's lots of debate in the field of neurology and psychiatry about stimulants. Are they helpful in having COVID-19 fatigue or not? Some patients we experience very good responses and some patients not. It depends on the cause and what is really affecting. So you have to discuss this with your neurologist and your doctor if stimulants are the right choice for you. And sometimes steroids. Steroids can give anyone energy. So if you take steroids, you will immediately feel better. But the problem is that it's a honeymoon period. You take steroids for a few days, you feel so much better, like a horse, and then you will crash afterwards. So steroids on the long term are not helpful because they have lots of side effects and the body gets used to them if you would. The only time steroids will be helpful if you have deficiency in steroids and your cortisol is low, then replacing steroids will be very helpful. And one of the other major complications is brain fog and memory function. You cannot really concentrate and focus and your brain is not working well. And to learn all about brain function and memory brain fog, you can see this video. I discuss it in details, and stay healthy and see you in the next one. Salam.